Okay, everybody, this is a new Shockwave device. Our other one's broke. We're trying to get it warrantied. This is a portable device. It's actually a little bit cheaper. There are things that I like about this one slightly more, so we may just go to having a couple of these versus one of the other. Depends on what happens with the warranty issue. This is electromagnetic versus an air compressor. There's some advantages to that. Unfortunately, it certainly is not more quiet. It's probably louder, actually, if that's even possible. We may need to get some earplugs for people, but instead of the intensity being displayed in bars, it's going to be displayed in joules. So basically, one bar is equivalent to 60 joules, and then it goes up by groups of 30 after that. So 2 bars would be 90 joules, 3 bars would be 120 joules, and then it goes to 150. So the units are a little bit different. Other than that, I actually feel like this is a little bit stronger. These caps will allow you to use ultrasound without having problems. You can see without the cap on there what it looks like. It should have a cap on it though. And again, if you want to use a gel, it makes it more conducive to that. These are plastic covers that can be placed on that dampen it even more. The starting point of this, which is I think 60 joules, it can still be a little uncomfortable. So if that's the case, you can put one of these on. I tried this on myself. These don't really stay on really well. They feel like they absorb a lot of the sound waves. I'm not a fan of these at all, but if somebody's really sensitive, I can see where you would want to use one of these. Other than that, this will be your option. We have different heads with this as well. You can tell we have some really small ones that do not need a cap. That would be, probably more for the ED issues that are being addressed here with some of our patients. But other than that, it's a similar manufacturer. You can see all of this looks the same. Again, the pictures don't really mean much because you still have to set the parameters anyway, so it doesn't really matter which one of these you press. But you can say that 60, I guess that's microjoules or MJs, that's as low as it goes. It's not going to go lower than that, and that's supposed to be equivalent to 1 bar, although it feels much stronger. The frequency, and the other one, it went up to like 20. This one tops out at 16. Remember, the higher the frequency, the more comfortable. And with this one, when you press go, this starts to go. So there's not a button on this like on the other unit. I'll just, I'll press that and let you see what we're doing here. It's going to get loud. So very similar to the other. So we can use that at least till our other one gets fixed. And again, I think once you start playing around with this, you'll find that there are some advantages to this one. Make sure you use it on yourself before you ever use it on a patient, and use it on a similar body part so that you know what they are filming. Thanks.